Usman, can you hear me?
Yeah, I can hear you clearly, sir.
Okay, so I'm just seeing that attendees are still signing in. So do we go live at 1:05?
No problem, sir.
Good morning, good afternoon, good evening, depending on what part of the world you are in. It's a pleasure, privilege, and a distinct honor of having you here with us today. My name is Olumide Okola. I work with the World Bank, and I will be introducing or welcoming you to this important webinar. Today, we're discussing generating and capitalizing on the demographic dividend potential of our great country, Nigeria. What is it that we really need to do in order to harness this potential? Nigeria is indeed a very large country, large population, currently at about 180 million, still counting. but it's projected by 2050, we will be a country of about 400 million people. That in itself portends a challenge, or it could actually be an opportunity to reap a bountiful dividend. Which way? So that's why we've put together this program, to be able to identify what are those set of interventions and policy actions that Nigeria needs to do in order to take advantage of a possible favorable population age structure. And in this regard, we thank the management of the Nigerian Economic Summit group that have, at the very last minute, considered this policy agenda to be of such huge importance and was accommodated as one of the very few pre-seminar webinar events. But not only that, I have been informed that this policy agenda will translate into one of the thematic actions that the NESG will take on board going forward. So this is not just going to be a one-off talk shop. No, it is going to lead to a series of actions where the NESG will use this as a platform to engage with the civil society stakeholders and high-level government officials to see how can we take advantage of this unique window of opportunity before it closes. Once again, I do welcome you all to this webinar. Apologies for starting a few minutes late, but you can bet that we have put together some of the most distinguished experts on this topic from both within and outside the country to do justice to this topic. May I now hand over to Mr. Nana Ude, Director NESG, to welcome us.
Thank you very much, Olumide, Your Excellencies, ladies and gentlemen. It is my great honor and privilege to welcome you to this pre-summit event for the 27th Nigerian Economic Summit, NEST 27. This event is jointly organized by the Federal Ministry of Finance, Budget and National Planning, the Nigerian Economic Summit Group, and the World Bank in Nigeria. I am particularly delighted that it is a follow-up to an insight session by the country director of the World Bank in Nigeria, Professor Shubham Chaudhary, which preceded the closing plenary of last year's summit, NEST 26. I also recall that NEST 25 before it hosted a plenary session titled Nigeria in 2050, Boom or Bust, which focused on managing our demography. I take us back to underscore the fact that this is a very important conversation, and we are committed to staying focused on it until we put in place sustainable frameworks to manage our demographic transition. And the time for action is now. Like most sub-Saharan African countries, Nigeria is experiencing a fast-growing population with progressively declining death rates and a persistently high total fertility rate. This has resulted in a slow demographic transition and poses a considerable risk for the country. At an annual average population growth rate of 3.5%, the rate of expansion in Nigeria's population greatly exceeds the current resource mobilization capacity of the government. And the growth rate of the real GDP, which has averaged 0.3% over the past 5 years. Consequently, unemployment and poverty rates continue to rise, even in periods of economic expansion. Moreover, the current population age structure in the country is considerably skewed toward young ages. This contrasts with a typical age structure in East Asia, where the working age population is proportionately greater than the share of dependents. The ratio of working age to dependents is expected to progressively increase from 1.1 in 2015 to between 1.4 to 1.7 by 2050, which implies that there will be increasingly more working age adults per every dependent. As it stands, the prospect of benefiting from a demographic dividend in Nigeria remains distant. This accentuates the need to engage with stakeholders on the urgency required for ramping up the transition, identifying bottlenecks, and articulating support from national and subnational governments, the private sector, and development partners. The theme of this year's summit is securing our future, the fierce urgency of now. So this pre-summit event is expected to critically identify a set of proactive policies that require urgent action for us to capitalize on the potential offered by the window of demographic opportunity, and this will take consideration of the decentralized governance structure in Nigeria, which may produce subnationally differential implementation and or commitment to policies and programs. This is particularly important given that the demographic window for favorable development opens approximately when the population under the age of 15 falls below 30% of the total population, and the proportion of people that are 65 years old and older is still under 15%. Unfortunately, Nigeria, like most other sub-Saharan African countries, remain far from this point. And with a high fertility rate and falling infant mortality rates, is not closing in on it. I hope that today's public-private dialogue will translate into a critical consensus that will create a sense of urgency around shaping policies that ensure Nigeria's demography produces a dividend and not a disaster. Once again, I welcome you to this event and urge you to register for the 27th Nigerian Economic Summit by going to www.nesgroup.org/27. I look forward to a robust deliberation, but even more importantly, impactful outcomes that can be implemented easily and quickly in the national interest. Thank you very much, and I hand over to Dr. Kumala to continue with the program.
Thank you very much, Nana, Director NES, for those remarks. Again, we thank the NES and the Federal Ministry of Finance, Budget and National Planning for this unique collaboration and partnership. May we then take some quick goodwill messages. First would be from the Niger National Population Commission, the agency that has been charged and mandated to manage issues around population policy in Nigeria. I then call on Alhaji Kwara, the Chairman, National Population Commission, for his goodwill remarks.
Good morning, participants. Good afternoon, rather. The Chairman, National Population Commission, is presently in New York attending UNGA. He has however, asked me to present a goodwill message on his behalf. My name is Dr. Itayo Yetunji. I'm a Federal Commissioner in National Population Commission and also the Chairman, Population Management Committee of the Commission. As we all are aware, the National Population Commission facilitated the launch of the roadmap to the DD, demographic dividend in Nigeria in 2017. Since then, National Population Commission has continued to provide leadership towards the implementation of the roadmap and the DD agenda in Nigeria. In 2020, the National Population Commission facilitated the study conducted by the Johns Hopkins University Center for Communication Program and subsequently launched the Demographic Dividend Scorecard for assessing progress made in the implementation of the DD roadmap in Nigeria. That report has continued to form a basis for assessing our progress and monitoring various programs towards implementation of the DD agenda. Following from that development, the National Population Commission, along with stakeholders and partners, also paved the way for the establishment of the DD Committee of Practice. The Committee of Practice has continued to be the forum where ideas, programs on the implementation of the DD agenda in Nigeria are discussed from time to time. Apart from providing leadership in the implementation of the DD program in Nigeria, the National Population Commission specifically has two major roles to play that will enhance the realization of the agenda in Nigeria. One is the review and the coordination of the implementation of the national population policy. And in this regard, I'm happy to announce on behalf of the chairman that the review process has been successfully conducted, and the Federal Executive Council has actually approved a revised national population policy. The policy is due to be launched any moment by Mr. President. A major thrust of the national population policy that is to be launched, the revised policy that is to be launched, is to hasten the demographic transition of Nigeria and to thereby also hasten the harnessing of the demographic dividend that will arise from that transition. And so most stakeholders were part of the process of the review, and we all are happy that that policy, when it is launched, will enhance the implementation of the DD program in Nigeria. Specifically, the policy aims at programs that will reduce fertility, programs that will reduce mortality in Nigeria. Because we all know that except there's a reduction in fertility and mortality, we cannot hasten the transition completely of the Nigerian population to a youth-based population, which is a precursor to the harnessing of the demographic agenda. And apart from the national population policy, another role that the National Population Commission plays or has to play towards the realization of the DD agenda is provision of accurate and up-to-date information on the population. Also in this regard, I'm also happy to announce that the National Population Commission is set to conduct a the next national census, national population and housing census in 2022, that is next year. Among other things, the census is going to provide the most accurate and up-to-date information on the age and the sex structure of the Nigerian population. We all know that most of the information that is available to us now are estimates, and sometimes they are based mainly on conjectures about where we are, what really is the age structure. And with that, we all know that with that information on the age and the sex structure of the population, we can only guess the level of transition that is taking place and how ready we are to actually harness the demographic dividend. In addition to the age and the sex structure, which the census is going to provide, the next census is also going to canvass other variables that will be very helpful in giving us information to help towards the implementation of the DD roadmap. Among such variables will be information on the level of literacy in the country. We also have information on the level of education of all individuals in the country. We have information on income. We have information on skill acquisition. These are very key variables that will enable understanding of the potentials and the distribution of these variables. The information on this, of course, we all know is what will help to know areas of intervention that are desirable in the population. The National Population Commission intends to conduct a digital census that will be utilizing a GIS technology. With that technology, a database that will be created is such that we can bring together other information on the population that will help not only in planning programs, but also in monitoring the implementation of the various programs that are targeted at harnessing the demographic dividend. We do hope that all stakeholders will join the National Population Commission in this very, very important task, which is less than 1 year away. I therefore call on all stakeholders to feel free to join the commission, to make inputs that will ensure that the outcome of the census will be of immense benefit towards this important agenda for the country. I thank you very much, and I wish us all a successful deliberation as we continue with this program. Thank you.
Thank you so much, Dr. Oyetunji, representing the Chairman, National Population Commission. Without much ado, I'd like to ask Professor Mohamed Pate, the Julia Frank Professor at Harvard University School of Medicine and Public Health, to give his goodwill remarks, knowing that the national population policy that Dr. Oyetunji referred to was one of those things that he had worked on as a former Minister of Health State himself. Professor Pate.
Thank you very much, Dr. Olumide. And let me also thank the Nigerian Economic Summit group for inviting me to say a few words at this important pre-summit event. It is very timely at this point in our history that we focus on what matters most, which is our population and where it's heading. A few years ago, we observed that when you look at Nigeria's population structure over the last 5 to 6 decades, it's been fairly stable in terms of the population structure compared to countries like Indonesia and Malaysia. So in collaboration with the National Bureau of Statistics, the World Economic Forum, and my colleagues at Harvard University, we took Nigeria's population structure and analyzed it, and it projected it for the next 50 years to understand its trajectories, both in terms of the population growth rate itself, as well as the economic trajectories. And I will share with you 4 key lessons from that exercise. One is that there is indeed a potential demographic dividend in Nigeria's future, starting from mid-2020s, soon to about 2050. In other words, the dividend is not an open-ended promise. It has to be reaped, and the window for the dividend can be actually closed over time. I'm sure we'll hear more about it in this pre-summit event. The second point was that the dividend is not automatic, and this has been alluded to already. We need to accelerate the reduction in fertility and mortality. Child mortality is a lead indicator, in fact, for reduction in desired fertility and fertility overall. Improve access to quality education for both boys and girls, in addition to providing reproductive and basic health services. Making changes to a labor market to encourage women participation is also equally important, and providing jobs for the youth, which are really coming up in this period. And the third lesson was that the timing of the demographic dividend varies by geopolitical zones. This decoupling of Nigeria's prospect for demographic dividend surprised us, because while we have a stable population structure, when you disaggregate it, you'll see that the Southeast geopolitical zone, the Southwest geopolitical zone, and the South-South geopolitical zone had similar population structures, very different than what you would see when you look at the Northwest geopolitical zone, the Northeast, and the North Central geopolitical zones. In fact, when you look at Southeast, you'll begin to see elements of demographic lag, meaning aging is beginning to creep up. And that's the other end of the dependency issue that we will face ultimately. The implication of this is that there is ongoing demographic transition happening in parts of Nigeria, and there are other parts of the country where you have higher dependency and lower per capita incomes. This decoupling is quite significant, and I hope will be something that policymakers will address, both at the federal level, but also at the subnational level. The fourth point was that the magnitude of this future demographic dividend also varies by the region. The northern geopolitical zones stand to gain more by aggressive reduction in fertility and mortality to reap the demographic dividend, given the population structures in those parts of the country. And I am very pleased to know that the National Population Commission has pushed through the new Nigerian population policy, which has been approved, as we have heard, and will be launched soon. But beyond the policy itself, the actions, the investments will need to follow so that Nigeria, in fact, reaps this potential demographic dividend in all ramifications, not only in terms of increase in labor supply, but also in improving savings and investment in human capital that the change in population structure enables us to gain. So I'll stop here and thank you once again. I'll listen carefully to the proceedings of this event. Thank you. Over to you, Dr. Olumide.
Thank you very much, Professor Pate. Indeed, hearing what you have said about the subnational variation, and indeed, if the northern regions, for instance, could accelerate the transition, perhaps the quantum of the dividend could be a whole lot more higher. So at this point, it is my pleasure to introduce my country director at the World Bank, Shubham Chaudhry, who himself used to be a professor of economics and also worked as an economist in Indonesia, one of the countries that has also benefited and reaped a dividend. And he was part of that story. No wonder he's here in Nigeria. And I do hope you'll be able to give us some perspectives on what exactly Nigeria needs to do. Like Professor Pate said, this will for a particular period of time after which it shuts. And the counterfactual in itself could be worrisome. Shubham, you have the floor.
Thank you very much, Olumide, and good morning to Professor Pate and others on that side of the world, and good afternoon to all the friends and partners I see connected. Look, with so many distinguished, knowledgeable participants and panelists who are going to speak or have already spoken, I'm going to keep my remarks very short. I think, and then kind of piggyback on what Nana said already and what Professor Pate has just said right now. First point I'd like to make is about the urgency of the choice Nigeria faces. I think Nana referred to the fact that, while this panel or event is titled Realizing Nigeria's Demographic Dividend, it could easily have also been titled, if you're a glass half empty sort, Avoiding Nigeria's Demographic Disaster. Okay? Because that is the choice that Nigeria faces at the moment. The demographic realities are what they are, but Nigeria it can either reap the benefits of its young and growing population, or it will have to reap the whirlwind of what accompanies this kind of unfettered population growth. But I want to put the choice actually at a slightly higher level. I'm an economist by training, so maybe I should not be speaking about such matters, but frankly, economists are only part of the story here, and certainly the World Bank as an international organization who's here to support Nigeria, but ultimately we're coming in as external partners. It is ultimately about a consensus within Nigeria. First and foremost amongst the elites, the political, business, and media elites, and then obviously the public at large, ordinary Nigerians agreeing on the choice and the direction for Nigeria. Why is this urgent? For some of the reasons that Olumide has already pointed out, and then also kind of the time-bound nature of the demographic, the window of opportunity for to take advantage of this particular demographic dividend that Professor Pate mentioned. Okay. Nigeria's real per capita income today is the same that it was 40 years ago, when its population was much smaller and when the problems of insecurity and fragility that now are starting to really sprout up everywhere in Nigeria were much less. If Nigeria continues along the trajectory of the last 4 decades, where it's been floating, sort of buffeted by swells of oil price movements and other fortuitous events, but never really taking its own destiny in its own hand, the next few decades could be quite dire. But Nigeria is also a country with tremendous potential. And a lot of that potential is kind of its young and growing population. And that's what we're here to talk about today. We will talk about the kinds of policies that Professor Pate already mentioned. But in order for those policies to have a hope of being adopted in the first place, and let alone being implemented, requires a political consensus about more fundamental things. And that's why it's very nice to see DG Ben here, because one of the fundamental choices is about how much public spending to dedicate to investments in human capital, in the primary healthcare services, in the basic education, in keeping adolescent girls in school. And that's a choice. And how the volume of fiscal resources that gets put towards those kinds of expenditures versus others, and such as gasoline PMS subsidies that benefit only the ultra rich and especially the ultra rich. So these are fundamental choices about the where public spending and public resources should be directed. Second fundamental choice about which there needs to be a consensus. And in this, I'm saying partly from the experience of Indonesia, of India, where I'm from, is the compact between the federal and subnational, and Nigeria is a subnational at both the level of the states and the level of local governments. That compact, that mutual understanding in terms of the roles and responsibilities, the flow of funds, the devolution of responsibilities, that there has to be a political consensus among that, about that, and an understanding both that within particular sectors, whether it's primary health or basic education, but also more broadly between the different levels of government. And then this is, again, a fundamental thing, which in order to have a hope of robustly implementing the kinds of policies that Professor Pate mentioned, that's a second fundamental area where there has to be a consensus. I think there are others, including, in the stage of, during the implementation, how does one ensure that there is that trust, that transparency, that accountability, so that the political classes are willing to let themselves be held accountable for delivering to ordinary citizens. That's a whole other area, but that's going to be very important. Lastly, let me say that, realizing the demographic dividend is one of those challenges that requires, solutions, contributions to that solution will come from all sides. Let me give you an example. We are financing and supporting a national program to keep adolescent girls in school. So we're providing about $500 million, and it's called AGILE, which is Adolescent Girls Initiative for Learning and Empowerment. The whole idea of the basic development objective of this program is to keep adolescent girls in school, because from that, a lot of other good things emanate. But if you diagnose the problem of why adolescent girls are dropping out at such high rates, usually the minute hit puberty in many places, the diagnosis suggests that there are many different routes to the problem and many different combinations of this. And so the solution will require tackling all of those routes. Some of the routes are supply side. A family is too poor to forego the income that an adolescent girl can bring in by working. Or a family may feel maybe hesitant to send their adolescent girl to a school that's far away. given all the problems of security. So that suggests a supply side solution in building schools closer to home. Another family may be, because of the communities they're coming from, may feel that, look, the role, there may be a hesitation to send their girls once they reach puberty, in a place where their safety and is not assured. So that requires, consensus amongst traditional leaders, building kind of more about social and behavioral changes. Others may have to do with how many female teachers are available to teach adolescent girls. So if you think about just that one issue, how do you keep adolescent girls in school? Requires thinking about financing for schools, the construction of schools. It requires thinking about providing for the security of the schools, perhaps conditional cash transfers to poor households so they don't have such a high opportunity cost. It requires social and behavioral change communications and a conversation with communities and traditional leaders. It requires teacher recruitment, especially female teachers. So that kind of multifaceted solution will require coordination across multiple parts of government and outside of government, and that's the challenge. And so some of the fundamentals that we mentioned, it's having the fiscal resources, having the coordination between the federal, state, and local government. The third bit of it is actually having mechanisms for coordinating across all the different actors and stakeholders. These are easier said, described than addressed, but I think unless there's a genuine consensus about these things, and it's consensus that's embraced and internalized by Nigerians at all levels, that the potential of the demographic dividend will be very hard to realize. I don't want to end on a pessimistic note. I think there's tremendous reasons for optimism, but I do think we need to view this as fundamentally a political challenge, where technocrats like myself, we can offer all the support we want, but ultimately it has to be a political choice by Nigerians. Thank you.
Thank you so much, Shubham. In fact, I would just encapsulate your speech as the NES, 27 NES consensus, not unlike the Washington consensus. But here, what you have outlined are pretty clear. As a nation, we need to have these four things: consensus around public financing, consensus around that compact between the national, federal, and local government, consensus around the multi-sectorality of the interventions required, and consensus amongst our elites, our traditional rulers, our politicians to say, this is what we need to do. And we've seen that kind of activity happen in countries like Bangladesh. So thank you so much, Shubham. And I think Mr. Laoye is on this call, and we know that NES is an activist platform that gets things going. And I do hope the four things that you have encapsulated are things that we will take forward to indeed accelerate the demographic transition in Nigeria, to give us that hope or that chance of reaping a dividend in the future. We move to the second phase of this webinar. I would then hand over to my colleague, Dr. Demola Olajide, a Nigerian, but who is also the country representative of the UNFPA Kenya. It's also a privilege to have the country rep of UNFPA Nigeria on this call. I hope we will hear from her at some point. But Dr. Olajide, the panel is yours.
Thank you very much, Dr. Okunla, and thank you to everybody who's taking time to join us. And I'd like to really appreciate the Nigerian Economic Summit Group for giving me this rare privilege. Listening to the speakers from the National Population Commission to Professor Pate, and then listening to the World Bank Country Director, I sat here really congratulating myself for being just a moderator and leaving the panelists to do the heavy lifting. Because when we listened also to the members of the Nigerian Economic Summit Group, they talked about the fierce urgency of the now. And one of the points that Professor Pate made, even though he seemed to have made it in passing, was the fact that we have a limited window. The facts try to show us that as of now, Nigeria has about 5% of its population above the age of 60 years. If we fast forward to 2050, we're going to have 25.3 million Nigerians above the age of 60. And so not only are we a young nation, we're also rapidly aging. And for countries that have harnessed the demographic dividend, they have one distinct advantage. They became rich before they became old. We are rapidly becoming old before we become rich. And so there is a fierce urgency for us to take concrete steps. And we're going to be listening to an interesting array of professionals who will be guiding us to address some of those issues that have been raised by the earlier speakers. We have with us today Mr. Ben Akabuize, the Director General of the Budget Office of the Federation. We have Ms. Yosola Akimbi, who is the coordinator of the Human Capital Development Working Group and of the National Economic Council. When each speaker speaks, their bio will be placed up there. Because of their rich experience, I'd like us to listen to them rather than have me read through their bios. We have Dr. Mero Mandara, who is a special advisor and coordinator, sustainable development, partnerships, humanitarian support to the executive governor of Borno State. We have Dr. Aisha Datsgupta, who is the demographic advisor with the FCBO. And of course, we have Professor Ibrahim Abubakar, who is the Dean Faculty of Population Health, University College London. So we're going to be having a rich array of thoughts that would help us curate concrete steps to be taken to help Nigeria capitalize on this very critical resource. Sometimes erroneously, we do believe that our petroleum is probably some of our most important resource, but this government realizes that it's about the people. And so I'm going to start with Mr. Ben Akabuize to please help us understand how government is expanding the fiscal space and strengthening the budgeting process to ensure that relevant interventions are funded. We've heard that this is not only a one-sectoral approach, and so achieving critical synergies, not only at the national level, but also at the subnational level, at the state level. Over to you, sir.
Well, thank you, Demola. Thank you, NES, for putting this together. In the interest of time, as we say in Nigeria, I'll say all protocols respectfully observed. I listened to a very knowledgeable and distinguished commentators who had already spoken, who brought the goodwill, Professor Pate, Dr. Shubham. And really, the first thing I'd like to say is that perhaps, especially in the context of the theme for this year's Economic Summit, which is, the fierce urgency of now, maybe this session should have been, titled "Generating and Rising," or basically something around the demographic dividend time bomb or whatever, rather than this word potential. I'm normally a glass half full person, Shubham made the distinction for us, but on this particular subject, I'm a glass half empty person. And I think that we need to, perhaps that's how we need to begin to frame this discussion. Leave this word potential and begin to maybe speak of the time bombs, of the disaster, of the catastrophe. Maybe that's what's actually going to make those who have to take action appreciate, the urgency. So that's my first issue. Well, I'm to speak about how government is expanding fiscal space. The truth is, expanding fiscal space in our current, environment is a tough, action. I am first to admit that we are not budgeting or not spending, nearly enough on human capital, but that's not because of a deliberate policy. It's simply because, the fiscal space is severely constrained, and the scope for, expanding that at this point in time is limited. From resource rents on which we have sadly depended for too long, we have constraints. Prices are not, being pulled down. The price of oil has not been pulled down by COVID or whatever other developments are outside of our control. You have instability or other failures in oil production, keeping volumes below and all of that. And, you know, as a commodity exporter, you really don't have much control. On the other hand, taxation, you know, we're still falling far short. I mean, the other day, the chairman of FIRS, I mean, disclosed at a public forum that in 2020, 40 million Nigerian individual taxpayers paid a total of 1 trillion naira in personal income taxes. 4 million South Africans paid 13 trillion, 13 times what 1/10, 13 times, 1/10 of the number. And that's not, you know, reflective of, you know, certainly the income patterns in those two countries. But what's worse for us is that we have a youth, you know, the youth of Nigeria growing up in an environment where they do not see paying taxes as something that is important, as something that they need to do. And so really, it's a difficult environment, you know, to, you know, expand fiscal space. You know, but what are we doing on the budget side in terms of trying to optimize the limited resources available? The first thing I have to say is that the insecurity in some parts of the country, particularly, especially, you know, with things like attacks on educational institutions and all of that, such can only slow down the, you know, and you know, this transition as far as, you know, reaping, you know, DD is concerned in Nigeria. And therefore, for us, despite the limited fiscal space, we're having to, you know, to devote an increasing share of, you know, fiscal resources to tackling the insecurity. So for 2021, for instance, if you add the supplementary budget, then the defense and security is using up about 22% of our budget, the federal budget for 2021. For 2022, that's projected at 15% of our, you know, budget on defense and security. And this is really taking away, you know, critically needed resources that, you know, could have been invested in, you know, human capital. You know, one of my big things recently is pushing the point that a budget is a moral document, not just some technical document or you know, some or legal document, but indeed a moral document that when you look at it should give you an indication what the country, you know, values. What does it value? Its budget should be able to give that indication. I believe that when you look at our budget, the bulk of the spending is actually, you know, targeted at you know, the youth. Oftentimes, commentators about how much Nigeria is spending or not spending on the youth, you know, look at the budget for Ministry of Youth and Sports and Social Development and call that the expenditure on youth, but that's not correct. I mean, practically all of our education is a key chunk of, you know, of our budget. You know, health is, and most of these, you know, are really basically the spending reflects the pattern of the population, but the education in particular is mostly for, you know, for the youth. The social investment programs, you know, whether it's Empower and all of those things are also, you know, basically, you know, targeted at, you know, at the youth. So it's not correct to say we're not spending, you know, but there are some specific initiatives that have been introduced. Last year, the president, you know, approved for the what's called a Youth Development Fund of 75 billion naira Youth Development Fund, and government will contribute 25 billion naira annually over 3 years. We made provision first 2021, 2022, we've included that again. But again, the managers of this fund are then required to leverage this and be able to attract additional resources. But it's actually difficult to plan from a budgetary standpoint about how to generate and capitalize on this demographic dividend potential if we really don't have accurate data on our demographics. When Dr. Okunola, introduced the session, he said Nigeria's population is 180 million. Current estimates are 210 million. When we were cutting the budget for COVID-19 vaccine, the Ministry of Health based it on a population estimate of 211 million. So numbers are all over the place. I believe that when Nana was speaking earlier also, he talked about a 3.5% population growth rate. The number that we are working off in the national planning is under 3%. So these numbers are all over the place. So it is absolutely critical, in my opinion, that we address the subject of a reliable population census. I'm one of those who believe that population is the mother of all data. And so for 2022, despite our fiscal constraints, we have made provision in the budget, a specific provision for the conduct of a census next year of 178 billion naira. This is in addition to the annual provisions we've been making for the National Population Commission over the past several years for them to do all the preliminary work, the nation area delineation and all of those kind of preparatory work. So we hope that this will be funds that will be efficiently spent and would deliver a reliable census for us with all, not just telling us how many we are, but really unpack the structure of this population for us and we have therefore going forward reliable data that we can work with. The chairman of the National Population Commission talked about a recent revision of the national population policy. As far as I recall, the current policy goes back to 1988, which makes it very dated. But I may have missed it because I've been very busy, focused on the budget. But I don't recall, if this thing has gone to FEC and FEC has now approved, I don't recall, or I must have missed a robust public debate on this policy, which is what I expect that we ought to have. That would then place the issues, squarely in the and let's have a real consensual policy document that fans understand and people understand what the issues are and why the policy has to and we have to stop playing politics with the subject of population. It's too important for us to think that. The current policy, there's an elephant in the room that people try and talk around which is the fact that we've got to limit the number of children per family. I don't know any other countries that over the last few decades have made this transition without taking that on board in developing their own population policy. And so I think that we will continue to this thing. We will continue to within the limits of available resources try and make provisions to deal with this. The order, in terms of programs for the youth, all kinds of provisions, intervention funds that have been provided for in the budget across different areas, whether it's humanitarian, first ministry, the institute itself. We have other agencies of government, like the central bank, funding all kinds of interventions as well. And so really, I think that oftentimes we make money the issue, whereas there are lots of other things that are more important that need to be addressed. And if they are addressed, the money will cease to be, an issue. For one thing, we know we have a predominantly youthful population, despite not having, up-to-date, data. And so our public expenditure, must take such into reckoning, and that's what we try to do. Thank you.
Thank you very much, sir. I mean, this has been a quite insightful conversation, and we also recognize the challenges that confront us with regards to ensuring that we have adequate resources for the range of interventions and sectors that will make a positive impact. You mentioned the issue of the population census. I see that the NPOPC is with us, and I hope they are listening. One of the privileges I have as a person is serving as a UNFPA rep here in Kenya that has done a census every 10 years since independence. And I do think that is key for us to be able to have data because it's about the people. And that brings me to Michionsola Akimbi, whose role in the coordination of the Human Capital Development Initiative of the National Economic Council can help us understand the progress we've made with regards to enhancing human capital development in Nigeria. Given that demographic dividend essentially is about the people and human capital, and what are the key strategies we have and the critical synergies between the sectors, what can we do differently, especially at the national and subnational level, listening to Professor Pate and the issue of the fact that different sections of the country are moving at different rates. Over to you, ma'am.
Thank you very much, Demola, and good afternoon and good morning to all participants and panelists. I must also start on a note of urgency, and I think I must give you the hashtag for the National Economic Council, which is push for HCD results. And this was resolved at the last meeting, well, 2 meetings ago of the National Economic Council, which is chaired by the Vice President, that we need to do something. And that's saying that Nigeria is not living in denial. We recognize the critical role that human capital development plays in driving sustained economic growth, productivity, and reducing poverty. And that's why the country has put in place this system for accelerating human capital development. We have 2 committees set up. We have the steering committee, which is chaired by the Vice President, and we have 6 regional governors that are members, and also the legislature, that's the National Assembly, that are members of this steering committee, and of course, the federal agencies. We also have the core working group, which I coordinate, and that core working group is not about the federal government. We have our key development partners, including NESG, and of course, Ministry of Health, Ministry of Labor, Ministry of Education. And that takes me to the 3 critical outcomes, the thematic areas that we have selected, which we think is really important in driving human capital development in Nigeria. We recognize, just like I think it's Professor Pate that made that point, that yes, we need to translate a demographic asset into something that is tangible. We need to move away from the dependent population and actually get to a population that is independent and productive. And so that's why this core working group that we have, that I said it's all about, not just about federal government, it's about the states, it's about the development partners, it's about the local government. We also have CSOs also as members of this committee working to drive this. And we have a 2-phase, we started in 2018. In that 2018, we said to ourselves, before we even proceed in terms of how we can begin to do things, let's see where we are. So we started off with the baseline study of the different states to see where we are. And I think Professor Pate actually put it very well, that we're in different shapes in all our regions. All the states have different things going on with them, but we know that transition and transformation must necessarily happen in the states. And so that's why it's important for us to understand that this second phase of our work involves working with all the states of Nigeria, and all of them have focal persons working with us and seeing what to do, the interventions that would help us in driving human capital development. And we said to ourselves, what we're thinking of is that by the year 2030, the productivity level should be about 70%. It's a very tall order. And I think that if we all work together, we can achieve this. So like I said, we have 6 critical outcomes that we have identified. There are different things that might happen, but we think that if we start on that note by reducing under 5 mortality, and of course, reducing under 5 stunting, making sure that the adult mortality rate is improved, especially focusing on mothers' mortality rate. We also said to ourselves that there needs to be improvements in primary and secondary school completion rate, but not taking away from focusing on the quality of learning. But most importantly, also, like we said, the labor force participation, we must focus on employment and of course, underemployment. These are the 6 critical outcomes spread over health, education, and labor force participation that we have set for ourselves, and we're working on a target. But of course, I must talk about the cross enablers, and I think it was the country director of World Bank that mentioned it, that it's not just about spending, Nigerian spending, we also need to focus on governance and also ensure accountability in what we're spending. And that's why when we're working with the states now, this is what we're saying with them. All the 36 states are actually very committed to it and all working with us. And I think recently meeting together, we all agreed that we really do not have time and that we all need to really focus on what we need to do. So like I said to you, it was a 2-phase approach. We started off with having a vision, which we launched in 2018. And that vision is to have healthy, productive, and educated Nigerians by the year 2030. On purpose 2030, we're just aligning with different development plans all over the world. And so we also said to ourselves that we have 16 critical interventions. We had series of workshops, co-creation workshops with different partners, with all the stakeholders, but we agreed that to do this, we need to be focused on these 16 critical interventions. And those intervention ports, like I said, ports across different things. And we have said to the state, what you need to do is to have initiatives around these interventions that we have. For health, we said it's important to operationalize the health insurance, BHCPA. We need to launch free fertility family planning program. And we also said to ourselves, it's important to launch effective financing mechanism, not taking away from operationalizing the national policy on nutrition and leveraging, of course, the private sector. And I think all the speakers have pointed to this. And in terms of education, we said it's important to roll out interventions for marginalized boys and also girls' education intervention. And we said we need to revamp the NCE and also optimize the process of teachers' certification. We need to improve development and performance management of the teachers and to revise the curriculum and the methodology of teaching. Like I said, labor force is so critical, and we said improvement and strategic focus on technical education is critical, and we need to improve the access to job market information, and also we need to improve legislative action, that is especially local content, to improve and increase hiring. And we need to be able to assist the SMSC financing. And also we said to ourselves that more importantly, also we need to work to assist how the SMSC are created, how they are organized, and also all these 16 interventions, The states, we have said to them, we recognize that you are all different, you are all in different stages, but you need to work with us. You need to have a model for working with us. We have our own architecture, set up yours. And I think now all the states have set up their architecture and they're working on all the 6 critical outcomes we have. And we know that monitoring for implementation, monitoring and evaluation is really important. So we have now established a dashboard, and that dashboard is being monitored. And I think all the governors in the next month will be able to track their progress online and to be able to see where they are. And what we have said to them, you all need to contribute towards ensuring that we move Nigeria forward. It's not about federal government, it's not about the states, it's all of us working together. And we also, just like Mr. Akabweze said, the DG, we know that the resources are not really, Nigeria is trying, the states also are trying. So we have actually come up with a very simple way of working through this. And that's a community initiative. We have called it CIMI. CIMI as in CIMI. CI for all the letters of development, for the first letters of development in the 3 Nigerian languages. To make it very easy, let's go to the communities. Let the communities begin to have process in which they can achieve these 6 critical outcomes. We don't need to have high infrastructure. We don't need to have big schools. We don't need to have big hospitals. Let's work at the local government level and see how the communities can help to do this. And we have said to the private sector also, yes, we are doing different things. You're doing your CSR. Why don't you focus on what the communities need? Go down to them, look at their CIMI, these community initiatives, and see how you can support them. Also, individuals, and especially wealthy individuals in the neighborhood or who are members of the society who come from these communities. Let's see how you can support the communities to achieve this. And if we are all really agreed on this, if we do this, if we now look forward and project, I can see the headlines of the papers in 2030, Nigeria's productivity level, 72%. It is possible. Let us all work together. Let's all put that at the side of our office, that hashtag, push for HCD results. We can do this, and it's all about us. So let's work together to make sure that Nigeria is pushing forward and is moving forward, and that productivity level is going up. And that's the time that we can also all smile and really be proud that we are Nigerians. I think my time is up. I'll take questions afterwards. Thank you very much.
Thank you very much. It's pleasing to see that quite a lot is happening, and there's deliberate effort to also bring in the subnational entities. Thanks so much for that. I'm going to move on to Dr. Meru Mandara. We've heard from the country director, World Bank, about the need to keep girls in school, the need to unearth what we call the girl dividend. As Dr. Dlamini Zuma, the first female chairperson of the African Union Commission, used to love to say, she would say, Africa consists about 50% women and girls, and they give back to the other 50. So it therefore means that if we do not optimize the girl dividend, we are going to be shooting ourselves in the foot. What can we do to optimize the girl dividend? What can we do differently? Over to you. Thank you.
Thank you very much. And it's such a pleasure to be part of this important meeting, and particularly to be part of this important discussion at this point in time. Having listened to Shuban and Professor Pate and all the other participants and the contributions they made, I choose to actually bring up a perspective that perhaps has not been discussed extensively, in my opinion. And that is, as Shuban said, we need to look at demand and supply. And therefore, even at the risk of boring you, I will still re-emphasize that, as you're all aware, investing in girls is perhaps the most profitable investment of all times. This is because girls, that is the future women, hold the key to the quality and therefore productivity of the next generation of human beings. I think we need to put that at the center of our discussions. We know that globally there are over 123 million young people between the ages of 15 and 24, and over 61% of them are females. Coming back home, we know that only 70% of children in primary school in sub-Saharan Africa complete secondary school. But out of that, only 13.9 actually finish secondary school. As the Emir of Kano, former Emir of Kano said in the recent investment summit in Kaduna, for every 100 children that go to school in Nigeria, 9 will go to the university and 1 will have a job. And that 1 is not likely to be a female. The capacity to accommodate graduates of primary education at the secondary level in Africa stands at 36%, and in Nigeria is actually 45%. I'm using this to bring to our consciousness that this is not just statistics. I think, in my opinion, this is a policy decision taken by Nigeria that 55% of our children do not deserve secondary school. For me, this is a policy statement. It's not an act of omission, it's an act of commission. And girls are particularly disadvantaged in this respect. Studies have shown time and time again that education of girls improves maternal mortality, improves child health, improves livelihood of women, improves contraceptive prevalence rate, improves child nutrition, and improves decision-making of women. So meaning, if there's any silver bullet that exists on earth to address all the indicators that we've been talking about, it's education of the girls who will now turn out to be women. So in my opinion, if we lack resources, if we are struggling voices, if there's any one silver bullet we need to look at, is just ensure that we educate women, because they choose to do the rest, because then you give them the power of choices. We do know that each year of secondary school education is reducing the age of marriage. If a girl completes secondary school education, she's likely to reach the age of 18. And this decreases her chances of early marriage. And as an obstetrician and gynecologist, that will reduce our cephalopelvic disproportion, that will decrease our not going to the hospital, that will increase a lot of obstetric emergencies that we see. 1 extra year of schooling increases an individual year's earning capacity by 10%, just 1 year of schooling. A mother who has secondary school education has a 50% more chance of her child reaching the age of 5 years. Now, even with this, we know that there's been countless projects, countless investments, World Bank, everybody, international development partners, government, everybody has been putting a lot of money for decades, hundreds of millions, to reduce the number of out-of-school children, especially out-of-school girls, to reduce maternal mortality, to reduce child mortality, improve contraception and nutrition. And we haven't seen impact commensurate to the level of investment. So for me, the question is, we need to take a break. I know it's urgent, but this is the time to take a deep breath and ask, why? Why are we investing? Why are we on a fire brigade approach and we're not seeing the impact? We're seeing inputs, we're seeing outputs, but we're not seeing long-term impacts. In my opinion, most of the education initiatives focus on primary school enrollment, retention, and most of the health and nutrition investments focus on training health workers, community sensitization, and the like. And I can understand where these are coming from, because a lot of people want to see impact in 2 years. Project cycles are 2 years. The biggest you can get is 5 years. Project cycles, some are 1 year. People want to see things, number of people trained. Educating girls, because of the significance women play in humanity, because of the significance women, the role women play, particularly in Africa and Nigeria. Educating women is not an educational issue, it's a social transformation issue. And until we begin to see that it is a social transformation issue, we will be looking at symptoms. We will not make the right diagnosis. We need to go beyond addressing symptoms and look at the diagnosis. Is it going to be easy? No. Is it going to be simple? No. For political class, are they going to count the number of projects and be clapped for? No. For development partners, are they going to tick the boxes? No, because this is social transformation. So therefore, I want to challenge our norm. And as we all know, a lot of us are scientists or social scientists. There's never been in history of mankind where you actually break and get the solution that we need by just running with the norm. You've got to dare to differ. You've got to do something different. The key to addressing most of our mortality, poor nutrition, as I said, is lies with education of girls and women. Now, unfortunately or fortunately, when you look at the researches and the publications, the first significant impact of education for girls is only seen after completion of secondary school education. So a lot of the investments we do, if it stops at primary school, there will not be changes in maternal mortality, child mortality, nutrition, and all the rest of it. And the girls would have reached 18, and therefore the natural prevention takes into effect. When girls and women are educated, they will make informed decisions to visit the many healthcare facilities that are built and not attended. When we build these healthcare facilities and women who carry children do not attend, they become goat states. They become whatever, we can put goats. They become buildings. They become just carcasses. But when you educate women, they attend these healthcare facilities. They will demand for quality healthcare services for themselves and their children, and they will make better choices about their family's nutrition, and they will be active members of the communities and demand for accountability in governance. Now to the crux of the matter. What is the problem with our current approaches? If the solution is so simple, why are we not making progress? In my opinion, we have not been very strategic in taking a long-term shot with short-term and medium-term steps and processes towards the attainment of a well-defined solution. If you look, what is our target for girls' education? Do we want, as a nation, do we want 30% of our girls to have finished secondary school by what year? I haven't seen that document. We're not very categorical and very sharp and clear in our goal. As Shuban said, we need to address both demand and supply. Now, I want to take you through a journey of what I do and what we do.
Please,
we need to recognize.
Can you try to finalize, Doc?
Sure. We need to recognize that the decision on whether girls enroll and complete secondary education is that of their parents, and caregivers are not of themselves. These decision makers are not likely to have formal education themselves, may not understand government policies and processes, and may not even trust governments and officials and politicians. What policies control their lives and social metrics of these decision makers and actions and their action and inaction actually define our future. It's not the elite, it's those people. In Nigeria, these decision makers are not governed or guided by our written policies. That they are guided by their unwritten policies as acclaimed by their religious and traditional leaders to guide them and decide what they do every day, whether they get to their schools, their children go to school or not. The parents of these and guardians of these girls trust their traditional and religious communities, and they support them on a daily basis. Therefore, in my opinion, it is very, very, very important that we listen to communities, we listen to what they say, and for a change, we let them take the lead, and we support them with technical assistance, and if I may, ask us to reduce what I normally call the arrogance of Western education. We think we know, but the truth is that we do not know. We need to listen. We need to put what they need at the center of the situation. And this way, if we do that, that will break the ice around the social norms of girls. And once we educate girls, I can assure you, we would fast reach our goal. But until we have the humility to know we do not know, and we do not have all the answers. And so therefore, for the next economic summit, I would want to appeal that we have a session where we bring ordinary people to tell us they are. And I can tell you will find that one of the key things they say is that if you want our girls to go to secondary school and finish, you need to make sure that these girls also, as they finish secondary school, they learn life and livelihood skills.
All right.
How many of our secondary schools are doing that? I thank you all.
Thank you very much, Dr. Mandara. I think you've made Mr. Ben Akwabe's job a lot easier. We can just direct our national budget towards girl child education, but I totally agree with you that it's very important. And indeed, I see my colleague from UNFPA here, it's a silver bullet. I'll quickly go to Dr. Aisha Dashgupta from the FCDU, who will provide us some guidance and some experience. What has worked elsewhere? You've listened to where we are as a nation. What can we learn from other economies and other countries and applicable to our situation? Over to you, Aisha.
Oh, good afternoon, fellow panel members and distinguished colleagues. All protocols observed. I actually want to start off with a quote that is now more than 60 years old. And it goes like this: unlike politics and economics, which move like the fast second hand of a watch, demography moves like the slow hour hand. Yet it's the hour hand of the watch that is most important, even if it seems immobile. And the point of the quote is really to spell out how important demography is. It might move slowly, but it gives crucial information. And it's more important than politics or economics, in my opinion, which can at times be distracting. So it's for this reason that I'm really grateful to the organisers for putting together this session and for bringing to light the importance of demography, and most especially the impact of rapid population growth and the possible benefits that can arise when there's a change in age structure. So we know from the experiences of other countries that when there's a prolonged period of rapid population growth, which is Nigeria's situation right now, it has far-reaching consequences on a multitude of factors, including the demands we make of nature and land to meet our needs, food security, stability, conflict, particularly when there's competition for resources. It has implications for humanitarian, the likelihood of novel infectious disease outbreaks, the demands we make of governmental services, for example, health and education, poverty reduction, and so on. So rapid population growth really has consequences for pretty much everything and can amplify all existing challenges. So from my past experience working as a demographer in other organizations, I've seen that the demographic dividend concept can be helpful when it draws attention to the links between population and the multitude of benefits that can come about when there's a change in age structure. And it's really helped to take population out from being in a silo on its own. But I've also observed that the concept of demographic dividend can be limiting, either when it's misunderstood as a benefit that arises from a growth in population numbers, for example, a growth in young people, or when it's assumed to automatically happen. No country has ever experienced a demographic dividend in the absence of a change in age structure. And a change in age structure occurs when there's a rapid decline in fertility. At current trends in Nigeria, there simply isn't a significant enough decline in fertility, and therefore there's no change in age structure. But although Nigeria is currently not anywhere near a path towards a demographic dividend, there's certainly scope that the trajectory could be shifted by policies that accelerate the demographic transition. So in terms of how it's been done in other parts of the world, I'm just going to outline a few common factors that have been seen in other countries that have gone through rapid demographic transitions and some which have experienced real dividends. So for example, this is Korea, Bangladesh, Ethiopia, Rwanda more recently. So one of the factors is real long-term commitment to family planning and demography at the highest levels. So for example, it really being made a national priority. In Rwanda, the president himself was committed to family planning. And the political commitment needs to go beyond just it being sat within the health sector. So in other countries, slowing population growth has been explicitly recognized as a key contributing factor to national priorities of youth, gender, women's empowerment, rural development, improved education, and so on. So another key factor has been family planning programs, including community-based services, and really empowering health extension workers to provide services to the hardest to reach women and couples. This, for example, was done in Bangladesh through door-to-door service provision to reach those women who were in Purdah. Successful family planning programs work to remove barriers, so there might be financial barriers, or they do task shifting to ensure that lower level healthcare providers are able to provide services, or family planning programs work to ensure that there's a full range of access to methods, or they strengthen logistics to reduce stockouts of commodities, and have tailored approaches for reaching adolescents and young people, including with comprehensive sexuality education. And a third factor that's been commonly seen is community engagement to address social norms around childbearing, including messaging around postponement of marriage and first birth, and in the involvement of religious and community leaders. So messaging in, for example, Rwanda was along the lines of produce the number of children that you're able to raise. In Bangladesh, on the national radio station, an hour a day was dedicated to discussions around family size and family planning. So including elements of social behavior change communication to shift those social norms around childbearing is key. To the question on what would be key pitfalls to avoid, my main comment would be around ensuring to take into consideration the stage of what a country is in with regards to the demographic transition. So a pitfall would be to focus on policies or interventions that from the perspective of demographic dividend are of relevance to either an earlier or a later stage of the demographic transition. At the moment, Nigeria is in the early stages of a demographic transition. So from the perspectives of demographic dividend, of demographic dividend, an intervention that would have been more relevant to an earlier stage would be around mortality, since there have already been dramatic declines in mortality when looking at the long-term perspective. Of course, mortality levels, especially amongst children, is still unacceptably high, but looking at that long-term, with that long-term perspective, it has already declined substantially. And another policy area that would be of great importance for the demographic dividend in, say, 50, however many decades time, would be those around labour market and employment and economic opportunities for the workforce because of the changed age structure. So the key policies and interventions at this stage in a demographic transition would really be those that focus on accelerating fertility decline, because it's that would lead to a change in age structure, and it's that would set up the possibility of a future demographic dividend. Nigeria, to me, is by far the most interesting of countries that I've been lucky enough to have had the opportunity to work in. Nigeria is probably one of the most consequential for the globe. And it's for this reason that when I was working on global estimates and projections of demographic indicators for the UN Population Division, my colleagues and I would always end up talking about one country, and that's Nigeria. Partly because the existing data are so uncertain, and partly because it's so large, growing so quickly, and therefore it's such a large influencer on global estimates and projections. But there's also a lot of uncertainty in projections. So, for example, the UN Population Division projects with 95% certainty that Nigeria's population in 2050 will fall somewhere between 350 million and 450 million people. That's a large difference of 100 million people, give or take. And that uncertainty is driven by what's going to happen to fertility rates, since that's the main driver of population growth. So the way to interpret that for me is that the actions that are taken now will determine whether the population is closer to 350 million or 450 million people. If fertility follows a path towards the upper end of the uncertainty interval, I think it's fairly safe to say that we can say goodbye to the possibility of a demographic dividend. If fertility follows a path towards the lower end of the uncertainty interval, I would suggest that there is the possibility of it resulting in a change in age structure, and then there is indeed the possibility of a demographic dividend. I'll leave it there. Thank you.
Thank you so much, Aisha. This has been quite interesting, and I'm quite intrigued by the fact that you have also highlighted the need for reproductive health commodity security, family planning programs driven at the highest level of governance. Indeed, we do not want to kiss the possibility of a demographic dividend goodbye. It will be catastrophic for us as a nation. And so my next speaker is Professor Ibrahim Abubakar, who is the Dean Faculty of Population Health, University College London. We had introduced him before he joined us. Prof, do we have significant policy gaps in Nigeria? If we do, what are they? But if we do not, because listening to all of the speakers, we seem to have some sort of policy here and there. What can we do to harness the human capital we already have in academia, private sector, diaspora, to bring everybody together in one coherent way to ensure that we do not miss the window of harnessing a demographic dividend? Over to you, Prof.
Thank you, and thank you very much for the invitation to join your panel. So I was reflecting on what I should say in response to your very interesting question. And I believe that several of your speakers have adequately covered the subject. And I thought I would start by saying there are three key priorities if you want to tackle this. And I suspect if you go back to your previous conferences or the conferences of any of the contributing organizations, you would have had these three factors. And they are: 1, girl education; 2, girl education; and 3, girl education. I list exactly the same thing 3 times and agree completely with Dr. Mandara that that is the crux of the matter if we want to change the trajectory of Nigeria. If you look across the world at what has changed in the dynamics of population growth and what has led to countries moving in the right direction, that is the core of it. Having said that, given that we know the answer, why hasn't it happened? And that's why I would say the issue is a lot more complex than knowing the answer as it appears on face value. As somebody born in Maiduguri and from Bauchi State, I'm going to call out the elephant in this room. The cultural religious element of this, illustrated by the fact that this is not an equally distributed issue across Nigeria, illustrates to me that the solutions can also not be generic and have to be context and culture specific. If we assume that we are going to, and if you look at the attendance list of this meeting and the panel, with the exception of Dr. Mandara, and having claimed being born in Maiduguri, I actually represent people in London, I would say that the discussion is not really taking into account the views of the people that we want to get on board. It is my firm belief that if we want to change the distribution of fertility rates in Nigeria, looking at the sort of numbers in the northeast and the northwest of Nigeria in terms of fertility rate and dependency ratio, the conversation around girl education has to center there. We cannot assume that it isn't possible to provide high quality education and high skill set using the Islamic education framework. And as long as we are not engaging people in that conversation, I think we're operating at the margins of what's possible. Having said that, I would argue that we cannot propose solutions on people. These solutions have to be led by the intellectual elite, by ordinary people and the Islamic ulama in the north and those states. And they have to join these tables and discuss with us what solutions are needed. And I know Dr. Mandara credited Sanusi Lamido with some of the ideas that he proposed, but we need many more people to be bold enough to join this conversation and get to the table to understand the complexity of the matter and identify critically what do we need to do to convince people that this isn't simply a health issue, This isn't simply about family planning. Important elements that they may be, because of course there are health consequences to getting demography right, but this is about livelihoods, this is about poverty, this is about development. No leader, no community member would argue with you if you want to better the lives of their people. And if we frame the discussion in that context, I believe that there's a chance that we can convince, in the same way as the Bengalis have moved in that direction, or Indonesia, or many other Muslim majority countries, where reproductive rates across the globe in the Muslim world has actually declined incredibly rapidly. It can be replicated in northern Nigeria. And I'm confident that that's the policy question that needs tackling. But we must not tackle individuals. We must tackle communities and groups. We must get them to buy into this and let it be that they are the ones arguing and saying to the government, to the leadership, that we want this to happen. Then we would make some progress. I'd like to add a couple of caveats because they're really important, which is that there's a risk that if those of us from without keep saying this family planning thing at the communities, it could end up being counterproductive. In fact, in places in the world, it has ended up stigmatizing the issue to levels where we actually achieve the opposite of what we want to do, sometimes causing harm in the communities. And absolutely, in no circumstance should we go in the direction of coercion around family planning. It must be that people buy into it because it is for their own good, and link it around education. And when women have the skills and know-how to contribute to the economy, they would realize and be able to move their lives in such a way that they don't have as many kids. And we would then have a chance to drive the demographic dividend. I'd like to finish with a couple of points. The first is an anecdote. About 6-7 years ago, I was invited by the American University of Beirut to give a talk, and I went out for dinner with their president. And there was a colleague here, an academic and a poet from Syria, who was pointing out the tragedy that was emerging in his country in the context of war, and pointed out the number of kids that are out of education, and described that as a demographic time bomb. Now, it is those intellectuals that are working hard, even in the context of war, in that setting, to minimize the impact, not very successfully, but at least outside of Syria, they are trying to improve the numbers getting onto secondary education and acquiring skills. We need the intellectuals in Nigeria, outside of government, in communities, to move us in that direction. Finally, whichever measure we use, whichever population estimate we use, whatever direction we use, if we get this right, I'm also confident, and I articulated this in a Lancet commentary last year, that we could be actually the provider of the global workforce. Nigeria could be poised with the right level of female education to be the source, and we would negotiate with all countries how much labor we are able to share with you if we get this right. Over.
Thank you very much, Prof. And I really, really appreciate the way you have capped this conversation. I saw that the moment you highlighted those three priorities, Dr. Mandela's camera came up. And the moment you mentioned Maiduguri, Mr. Alkabwezi also remembered that he was born there, and he also shared that. So you can see that for us as a nation, we have that capacity. And I totally agree with you. If we get this right, and when we do get it right, we can actually begin to export human capital in a way that we can drive economies of several nations and contribute to it. I would hand over right now to Dr. Nkata Chukwu, who's going to take us through the question and answer session, as we have the participants also participate in this very, very important conversation. Kata?
Yeah, thank you very much, Demola. It's actually been a very, very insightful session. And I like the way you went at the end with a lot of, direct, blunt, truth saying or speaking in terms of, besides all bringing experts and all that, really getting down into the community to find ways to work with structures that can allow us move, so that the issues that are really critical are not seen as issues from outsiders. So I would start with Yula, the country rep of UNFPA in Nigeria. To also UNFPA, we know, has been playing a leading role. Demola is Nigerian, but he's Kenyan for today. So we'll allow Yula to also speak to us, about some of the work that is going on to address the issue of demographic transition towards really earning some demographic dividends. Yula, over to you, please.
Thank you very much. And thank you very much for opening the floor for me. I really appreciate it. I think it's been a really interesting conversation, and many very good things, many correct things have been said about where we are in Nigeria. I guess, though, as you know, the lead partner, UNFPA, has developed the demographic dividend roadmap with the National Population Commission. We've been a key partner in developing the new population strategy. And of course, we are also now debating strategies around the census and how do we do that. I think my concern is considering the quality of the roadmap towards the demographic dividend, which is a really high quality Nigerian-led roadmap. We have to be careful that we do not reinvent the wheel. I think it has been said many times that we keep doing the same thing again and again and again and nothing comes over it. One of the things we often tend to do is actually reinventing the wheel. We put old wine on new bottles, I think is a saying you can use. And that is concerning for me because we have actually got a roadmap. It's a roadmap that has 4 pillars. It's family planning and health and well-being, education and skills development, not to forget vocational skills. Not much has been said about that in this call, but vocational skills is really critical for nation building because we do need electricians and plumbers and masonries. We need all of that. And there's not a strong focus on that in Nigeria. And then, of course, there's the broader employment and entrepreneurship pillar, and then governance and youth participation. So I think, you know, we kind of know what needs to be done. We know globally, we heard from Dr. Gupta what has worked in other countries. We've heard from Borno State, you know, we all know it. What I think is concerning is maybe that we're not really addressing a lot of the elephant in the room. And it's always difficult for someone like me to come in and raise this, but I'm gonna give it a shot anyway. So Shubham, our country director for the World Bank, asked one question: what does it require to keep an adolescent girl in school? Well, first of all, to keep her in school, she needs not to get married when she's 14, because that is one of the key challenges. Girls are married and then they're pulled out of school in large numbers in many states across Nigeria. So that is something we must address. Another thing that we must address is also young girls, even if they are not married, must have access to contraception. It is very sensitive, and I know it is sensitive, but bottom line is that teen pregnancies in Nigeria are very, very high. And if we do not address that, we will continue to have issues around girls drop out and getting girls staying and remaining in school. And the same when it comes to family planning. It is always hidden away a little bit under the health umbrella. But bottom line is the 2 key legs, the 2 key drivers of a demographic dividend and the transition is family planning. It is critical we figure out how we can talk about it. And it is critical that we start getting the federal government and the state governments to talk about it, to talk about why this is important, why spacing of your children is important, because it impacts on all of us. And we are not there yet in Nigeria. We are not able to have that conversation, and we don't have that political leadership. I think a lot of the politicians that I've engaged with at all levels, they know it, they understand it, and they support it. But to take it into the public space is a very, very different avenue. And we have to find out how we can do that in a non-conflictuous way, so it becomes a constructive conversation. I know I'm sort of been invited in, so I will not take too much of your time. I just want to make a few more points about this. And that is that when we are preparing for achieving a demographic dividend, and when we are talking about engaging in communities, yes, religious and traditional leaders are extremely important, but we also need to make an effort to talk directly with the women and directly with the young people without having all the others in it. It's a difference. It's not always the same answers we're getting. So I would really invite, a more open conversation around how we address these issues, because family planning is also been proven, and I think it was the Borno representative, Dr. Myro, who said it. it's one of the best investments we can do. And there was also one more, I'm sorry, I forgot the name who mentioned that. The Copenhagen Consensus proved that only trade gives a higher return on the investment than family planning. That means it's pretty much a no-brainer to invest in family planning because the return on investment to the state is high. I will leave it at that and just also say we are working very closely to address another concern that was raised here, that we are working closely with the National Population Council Commission to ensure that we get a high-quality census. But we can talk about that another day. Thank you very much.
Yeah. Thank you very much, Yola. Thank you for that. So we will just take one more comment, but actually we'll direct one of the questions to somebody who's not shown up so far as a panelist, just to also get some perspectives. Dr. Ejike Oji, we have some questions around, Dr. Mero has already spoken about the need to invest in girls, right? But we have these questions around how do we, besides just talking about this, working with the communities, getting the perspective of the people we're targeting, from the civil society perspective, right? How do we actually do this? And please just keep it brief, 2 minutes tops, please. Thank you.
Okay, thank you very much for having me here. I thank all the discussants so far. They've made all the points. We've been saying from the Association for the Advancement of Family Planning perspective that we must all of us have a philosophical overview of what we need to do to move things forward. If you look at all the policies that have been made in the country, there's nothing that we have not done properly. People even import what we have and make good use of it wherever they are on earth. Our problem we need to disaggregate, is it at the leadership level, governance, or service delivery, or even how we monitor and make sure that there's accountability at all spheres. Talking about community participation, there's no doubt that you can't say something, you can't do for me, say you are doing for me without including me in the conversation. We've always said that communities must be involved, and that's why at the association, we make sure that we bring women, we bring young people, and we bring the interfaith group in all the conversations we have, especially in our family planning conference. And we have driven very robustly this last process of doing a recommitment for 2030, making sure that the sub-nationals are involved. Just like we're having all these conversations, I expected also to see the Nigerian Governors Forum on this platform. Because if you look at issues of family planning, decision-making in terms of policy and the drive and how we allocate resources, a lot has been done at the federal level, but at the sub-national level, not much has been done. So that's where we have to take the information down to. And government has all the structures. I'll give you an example. National Orientation Agency has about 4,000 staff across Nigeria. In my local government, there's assistant director level staff at the local government. How have we used these structures to reach people? So we must develop the clear communication that will resonate with our people and make them understand that for us to go from demography crisis to dividend, there should be a transition first. We're even all talking about the dividend. We have not even gotten to transition. And for Nigeria to get to that transition, we have to invest about $400 million between now and 2030. And at the same time, make sure that we have our fertility rate to be 4. We are at 5.3 as we speak. So that drive has to come from the locals. Like every other person has said, for people who have commented on this, we need to have proper public education and community engagement on these issues if we have to make a concerted effort to come out.
Thank you. Hello.
The district that we are now. Thank you very much.
Thank you very much. So just to quickly take on some of the questions from our participants, Chukemeka, one of our participants, Chukemeka, would like to know, to free up more women into the labor market, are there any plans to invest in unpaid care, knowing that there are a lot of these domestic things that also keep our women, away from the proper labor market? I will direct that to Yosola, who is the HCD advisor. I think she's well placed to answer that. Yosola, over to you, please.
Thank you very much. It's just that I really didn't have time, to talk about the robust system, the robust process of ensuring that we have our women taken care of, including how do we ensure that we pay for some of the care that, including even home care, and how do we ensure that the woman is actually really compensated for some of the roles. And while I was on a call yesterday, it was focused on COVID and what the impact on women, not just in advanced or developed countries, but also in this part of the world in terms of what it has taken from them and how are we going to really compensate them. So I think this is one question. This is something that the core working group is working on, and it's part of what we're trying to track and monitor across the states of Nigeria to ensure that the women folk are really all that they're doing, including the ones that normally we won't even take care of, we won't account for, are the ones that are accounted for, and we're monitoring and tracking progress across those lines.
Yeah, thank you very much. Another participant, Ebere, has this interesting one, which I'll direct to Oyetunji, the rep of the MPC chairman. He wants to know, he's saying that we know that census in Nigeria have been highly politicized over the years. And he's wondering, as we move towards 2023, an election year and all the incentives around numbers, how is the MPC going to ensure that this time around the census is really provides data that is reliable and is removed from as much politics as possible?
Well, thank you very much. It's a very good question to ask, and even back home, we too, it's something we have thought carefully about. First, I'd like to appreciate the DG budget. Like he said, it took a lot of courage actually to make provision for a census next year. We here will appreciate and will take it with all responsibility. He did mention that for quite some time now, we have been undertaking some preparatory activities. Specifically, we have been doing what we call the enumeration area demarcation, which is actually demarcating the entire country into small units. We're using the satellite imageries now, images that have very high resolution, where all the buildings throughout the country are evident. We can see them. And that's the base that we're using. For every member of the population that is enumerated, we'll be able to attach them to a building on the ground. With that kind of accuracy, we expect that we'll rise above any politicization. The last census in 2006 was conducted a year before election in 2007, and it was successful. We have the assurance that this time around too, we'll be able to do it, especially in view of the kind of technology that we're deploying. It's a technology that is going to minimize errors, and it's going to make it difficult for falsification of figures and all that. I'd like to reiterate, and I'm glad with many contributions that came in later, that without accurate information on the age structure of the population and the distribution of this structure, many of the interventions that have been planned are just planned in the air. The base must start with accurate information. And we do hope that with the kind of census that we're committed to conduct in the National Population Commission next year, that information will be available for many of the stakeholders who are intend to make interventions. I also did say that, and this will address, just a second, it will address issues that were raised by the country director of the World Bank. The national population policy that has been approved has made provision for what he called consensus at all levels. There are organs that have been provided in that policy at national, subnational, even local government level, that if implemented, will create opportunity, not just for government officials, but even community-based leaders to have participation in the process of implementing interventions that will bring down fertility and mortality. What we're calling for is for all stakeholders to believe in the National Population Commission, that these two major areas of contributions, the national population policy and the national census, if we have the required support, will be major contributions that will help in the realization of the demographic agenda. So I want to assure the questionnaire that we are ready to do a census that is going to be accurate and devoid of political manipulation. We did it in 2006 before the election, and we can do it now also. Thank you.
Yeah, thank you. Thank you very much for that very important reassurance. We all do hope and pray that we actually get it 100% right. For the sake of time, please, there are a few other questions. What we'll do is we'll try to reach out to you directly. We'll get responses from the panelists and get those across to you. We'll note those sent in. Please, if you have yourself as anonymous attendee, you'll have to let us know how to reach you. You can send a direct chat to anybody from the NESG group. So I'll quickly hand over back to Demola to wrap up the session since we're already coming to the end. Thank you very much.
Thank you very much, Ekata, and thank you, colleagues, for what has been very interesting conversation. And as we curate the information from this, it would also include some of the answers to some of the critical questions. As we wrap up, I'd like to, first of all, knowing fully well that partnerships is key in trying to achieve what we set out to in harnessing the dividend, I'd like to invite 1 minute intervention from Tijani Mohammed of the Bill and Melinda Gates Foundation. What is the perspective you're trying to share with us, given your level of investment across Africa? What have you seen that worked? What can you quickly put on the table for us in 1 minute? Tijani, are you here? Okay.
I think we can move on.
Okay, so then I would finally just like to thank everybody on the panel. This has been an interesting conversation, and I do think we need to find a way to continue this. A lot of things have been put on the table, which requires all of us in a coherent manner to take it forward. And it's been quite insightful. I do believe that as a nation, we stand at the cusp of harnessing a demographic dividend. We need to ensure the transition, and we need to put in place the series of intervention that will create critical synergies to take us there. So really want to thank every single member of the panel, everyone who has intervened. And before we hand over to the CEO of the Nigerian Economic Summit Group, I would invite the country director of World Bank to make a 1 minute roundup, and then we invite the DG NESG. Shubham?
Thank you very much, Demola. So let me just say, this was fascinating, really gives me renewed energy and then a sense of how we can come in. I think I will go with what Dr. Ibrahim said and what Dr. Myra Mandara said. Girls' education, girls' education, girls' education. We have this Agile program that we're very excited about supporting, and we will do our best to kind of, not that that's the only thing we will do, but we will make every effort to make sure that that takes off in the way that both Dr. Ibrahim and Dr. Myro emphasized, by listening to the communities in question and looking at the leaders and intellectual elites to guide us in how to move forward. Thank you.
Thank you very much. You have hit the nail on the head. As they say in this part of Africa, you cannot shave a man's head in his absence. We need to begin to engage the communities much more closely and listen to them. It's a pleasure to now invite the CEO of the NESG, Mr. Laoye Jayola.
Thank you, Demola, for a brilliant work. Because you had called Tijani and I can see, then he didn't have an answer. Tijani, you can take 1 minute out of my minute. 1 minute to say whatever I want to say, and then I will then. So I saw him in there.
Thank you so much. Just to, in 1 minute, I will say that we have found that, investment in maternal child health have, yielded huge dividends in terms of, demographic transition in other countries, but, potentially in Nigeria. So I will say that, call on our partnership to sustain this. There is also, in addition to the young and women, the issue of the aged. If we can improve, old age entitlement and for people to live longer, it is likely that we will have that mortality decline that must precede fertility decline, and to achieve that demographic transition. So thank you so much for the opportunity. Back to you.
Thank you very much. And let me thank Olumide for pushing this. I mean, by the time we created the pre-summit program, it was difficult for us to see how to bring it in. But because this is an agenda, this is a discussion that we have on, and what my director said at the beginning, we started this discussion almost about 4 or 5 years ago. And I will believe that the more we talk about it, the more we build a consensus around this discussion, the better for all of us. We had to find a way to put it in there. I'm supposed to give a closing remark, but mine is a closing charge that we have no choice whatsoever. But for us to work and be effective at it, we need to build trust. Part of the reasons why we're having challenge dealing with what we're dealing with is absence of trust. There is supposed to be inclusion and there's supposed to be accountability. And all of us, I mean, I don't believe it's only government, it's civil society, all of us stakeholders, we need to begin to speak and then begin to ensure that we work together. So I appreciate the NESG, appreciate the collaboration and all the work that's done around here. We'll look forward to further collaboration if really we want to take advantage of these democratic dividend in a shape or form. And I want to again use the opportunity again to invite all of us to the summit itself that holds on the 26th and the 27th. It's a hybrid, both 25th and 26th, hybrid. Both it's Abuja is a command center, but anywhere in the world you can join us. I know they'll put the attack online. So thank you, Moses Ali, and we look forward to continuing this dialogue. As we say in NESG, the dialogue continues. Thank you.
Thank you, everybody. Bye.
Bye, everybody.
Bye.
Bye.
Hi,
Bye,
Ben.
everyone.
Hi, Ben.
Hi.
I'd like to see you.
I
would like to see you, Ben.
Okay.
Give me a date today.
Okay, that's fine. You'll have to get to New York today.
I like that. Okay, when you come back then.
All right then.
Safe trip, my brother.
Thank you. God bless you.
And you too.
The day he was